look at lasers, I look at laser technology, I look at three things, you know, three important R's, you know. I look at the results, and I look at the recovery, and then I look at the reproducibility. So if a laser can meet or exceed all of those, then I'm in. And for over 20 years, I used another great laser company's technology, which is great, but this, in the last several years, has changed the whole game in lasers because of those three R's. And I really think it's amazing. And really, this is really the take-home slide, because not only does it have all of those three R's, the reproducibility, the results, and really the recovery is that it's safe in all skin types. That's really important. And it's one handle, one modality, you know, 7 different ways you can use it, 10 different indications, as you saw Misty talk about. And the biggest thing, because I have a face and cosmetic practice, is that the recovery time is less than half of other laser technology. That to me has been a game changer, because when I'm doing a facelift, the only thing I ever heard about in the past, because faces, believe it or not, do not cause a lot of pain, was the laser. And it looked like a burn patient, but UltraClear has transformed that. Because within 6-7 days, and I go very deep, and David even goes deeper in the office, it's changed that. So it's very versatile, and you get incredible results. Now, why do you say that? Well, because it is an ultimate versatile device, going from the stratus corneum all the way to targeting the epidermis to laser-enabled cutting. Now, I'm at the other end, laser coring, and of course, UltraClear. And David's actually going to show a lot of that today, which is great in our patient right here. And of course, most of the time I'm doing these with my facelift. But that is incredible. One device, no disposables. I mean, that's the beauty of this versus some of the other technology hasn't necessarily been updated, but this is really, to me, it's been a game changer. You know, so 7 applications, 10 different indications, and more. And really, it's simple. It's simple to use. From, you know, you can delegate it from your esthetician, depending on the state you're in, nurse practitioner, from 3D Miracle, from going from the stratus corneum to the epidermis to the dermis, to then to the deep layer, which is where I like to live, in the laser coring. And we'll talk about how that differs from a mechanical laser coring, which is also a good device. You know, the good thing is we try and do research with all of these companies because we want to understand technology so that we can apply it to patients. So that's very, very powerful. And it's versatile in all skin types, which is also, to me, a game changer, because in general, before I used UltraClear, I would stay away from anything above 3s. And David's done 4s and 5s, but and you'll see some of these examples in here. And then, so you always ask, why? Well, why is this so different? Well, it's customizable, and because of the impact is because it's more rapid speed and a smaller diameter. And I think that's the game changer here, because the traditional YAG lasers, this is 2910, the 2940 and others, they have a little too little thermal impact. The CO2, which I haven't used in a long time, too much thermal impact, too much hyperpigmentation. I don't like that laser. So basically, it's that rapid speed and also the total diameter being very small. And that's really, in a nutshell, why it works so brilliantly and so efficiently. And also it's because of the less pain and much less discomfort. And it's amazing. And I'm going to show a video of a lady that's now 13 days after her facelift. I'm going to show her video at the end before I hand it over to David. And it's that impact that I think has been a game changer. Now this is a busy slide, but basically when you compare it to other types of lasers, which are also great, and we've used some of these lasers for 20 years, is that it's really, I think, single handpiece, single use, very adaptable, and rapid micropulses, less discomfort. And then the risk of pigmentation issues is minimal. I haven't had any. David, have you had any pigmentation issues? And I've had some with my other Erbium lasers. And the learning curve, the great thing about learning curves here is that it is for plastic surgeons, dermatologists, and for sophisticated nurse practitioners and nurses. This is so versatile. You have to understand the lasers. So it's very, very powerful. So, I mean, it's the 3D intelligence pulse. But basically, what it is, it gives you more pulse therapy, and basically, let me just show you how that works. And basically, it's multiple small diameter, and it's pulse delivery for ultra micro pulses. And I think that's the difference, I think, and that really allows you to get into the sweet spot of more rapid recovery, less pain and discomfort, which I don't know if that's a big concern to you, but that's always been a pushback from laser patients. So listen, my sister had a laser and she looked like a burn victim for 2 weeks, and that was always the downside. And now, I mean, I use resurfacing for almost every facial rejuvenation patient. So, so I'm going to turn it over to David because he's going to talk a little bit about the clear, UltraClear, and then I'll get back to you on some of the micro.
Great, thanks so much, Dr. Rohr. So yeah, we brought this laser on last September, and I really talked Dr. Rohr into it because I was really impressed with the technology because we were an Erbium user. We like to blow people's faces off. We typically have to do it in the OR because they have to do anesthesia because of the zone of impact that our older technologies did. So the thing that really stood out with the UltraClear was this pulse technology, this kind of a zone of coagulation, less coagulation, so coagulation, less coagulation, coagulation. So you can do it in office. I can do very aggressive treatments, more aggressive than Dr. Rohr does in the OR, with my patient using topical, maybe a little local if I'm being extra aggressive that day, or maybe even with a little nerve block if I have to. So I'm going to run through the different modes and the modalities and how I use them in office. So 3D Miracle and Clear modes, these are going to be your very, very superficial treatments. 3D Miracle, we don't even numb for in our office. This is 10 microns deep. You can set it, it's about 25 to 35% coverage in your spot size. So these patients don't even come in. And they come in, this is a 15-minute appointment. It goes very, very fast, and you can see it's going to be very similar to like a microneedling healing journey. And I would equate it to like a very light to medium chemical peel, and it's going to be safe for any Fitzpatrick because it's just the superficial shot of corneal effective. The other great thing about 3D Miracle, and a way that we've had it kind of take off in our practice, is that I have some of our assistants doing the 3D Miracle on people's hands. Like every person that walks through the door, because there's no consumable, we already paid for their device, so I just have them do it on one hand, and then do it on the other hand. And then sure enough, 2 weeks later, they call me like, oh yeah, I want that done in my face.
And no downtime.
And there's no downtime to it. It doesn't hurt, it just feels like a little like warm, almost like a UV therapy, like light therapy. So this is some good examples of what clear mode can do. So it's targeting that stratum tone. So it's going to help with pigmentation, vascular dyschromia, mild photo damage, and overall complexion renewal. This is actually indicated for vascularity, so diffuse redness. So I was actually very surprised, and if you look on my Instagram, there's some before and afters of people that it almost looks like a BBL or an IPL, and it wasn't. It was just a 3D Miracle, and the diffuse redness was greatly reduced by increasing. And I talked to Mary Depot about this. She's a big dermatologist in Louisiana. And I'm like, what's happening here? And we kind of deduced that just by knocking off the stratum corneum, you're getting that kind of dermal hypertrophy, that extra dermal thickening, which is hiding the vascularity. So clear mode, you can see, you can go very aggressive, especially if you have any sort of large dyschromia like this. And I'm assuming I don't have settings on my settings. So this was a 50% coverage at 3 ratings. So this is a completely ablating 15 microns deep of the entire superficial surface areas of the skin. But I wouldn't even have done for this treatment. That's how comfortable it would have been. This is clear mode in the neck. The treatment settings on this, and I'll go over settings that I use whenever we do the live demo, but this is just a 25% coverage, 10 microns deep. This is ablated kind of poikiloderma as well as some awesome, some terrible sun damage. And this is very hard to treat. And this is actually one of those patients.
Right, and this was actually the patient that actually made me look at UltraClear. Mary Depot, all of you know, she's an incredible dermatologist, she's very vocal. But this, because there's no treatment for this, so hopefully you're on the spot. I mean, it's phenomenal.
So here's Clear Plus mode. So Clear Plus mode is going a little bit deeper. So this is going beyond 30 microns deep in the skin, so up to like 40 or plus. You can look at the pigmented vascular lesions that's on the back of his hand, as well as that dermal thickening that's happening. With Clear Plus mode, this is something that you probably would numb for if the patient is pain insensitive. If they have a really good high pain tolerance, I wouldn't numb for it, but if they are pain insensitive, I'd probably put Laser on for about 30 minutes before I did this treatment. So UltraClear as far as scars and acne. Now I work with, how many plastic surgeons are you guys have? There's 12. There's one of me and 12 of them. So I work with a lot of scars. So I love scars. So these next slides are really interesting because this is combining the technology of UltraClear. So this is Ultra Mode. So Ultra Mode is blasting 175 micron deep channel into the skin. And if you look at this histology, it's really interesting because the zone of coagulation around there is only about 25 microns. So that's how well controlled you can actually control your zone of coagulation. Now don't get me wrong, if you're not working with a scar and you're trying to get increased tissue tightening, you can increase your coagulation effect up to 10, so you can get a really nice zone if you want one, but of course that's going to be patient dependent, Fitzpatrick dependent, and how much downtime and recovery the patient can have. But on its lowest setting, as far as the one in coagulation, you can see that there's only that 25 micron wide area effect around the channel. So that's where you get that really nice increase in healing, that decrease in downtime, and also that very effective patient treatment with very, very low pain thresholds. This is a great treatment on a scar around the face. And you can see now this is, of course, the before treatment, after 5 RF microneedling treatments is the middle, and then after 1 UltraClear treatment. So you can see how much vascular area is picked up when you combine modalities, and you can see how much scar tissue you can remodel. With the Ultra, you can customize these 170 micron channels as deep as you want to go, and as how dense as you want to go. So typically I'm working between a 1 to 2% density, and depending on the patient's skin thickness, if I'm just doing anti-aging, I might be doing a path at 300 microns deep, 500, maybe 750 microns deep. If I'm working on scars, I might be doing like 300, 500, 1,000, and I'm trying to really get deep into the spot. So this is Ultra Mode with Clear Mode. So this is one of my favorite things to do, especially on my younger patients that are like in their 30s. I consider that young nowadays, I'll just age myself. But they're that pre-rejuvenation patient, like they're just now starting to get breaks in their superficial fat compartments. They're just starting to see that skin laxity. And you can come in, and there's a really cool mode. For me, it was called Paint, but now I think it's called Glide, because we have some experimental versions in our office, because we get the fun stuff. But it's called Glide. Well, I think it's commercially called Glide now. But basically, you can set the Ultra mode at whatever depth you want, and just like there's spray painting, you just paint over the entire face. So, I don't know if this one has it, but it does have, I'll show you what it looks like today. So this is what I do for a lot of my younger patients. I just come in, I do about 300 or 500 microns deep in Glide mode and treat the entire face. So I'm really just targeting the dermis at that point. And then I'll go back with Clear mode and just hit the stratocorneum and just give a light chemical peel or light resurfacing. And depending on how much dyschromia they have would determine my density and my depth of treatment. This is another great before and after. I mean, look at how much, and this is like a fixed 4, 3 plus. This is the Asian patient. So this is someone that I would normally be very wary of using an Erbium on, let's be honest, you know. But because my traditional older version of my Erbium had so much coagulative impact in the rest of the skin that my risk profile for hyperpigmentation was very high. And from that histology slide earlier that we looked at, with that very, very low 25 microns wide of impact, you have very, very low chances of causing any sort of hyperpigmentation or hypopigmentation. And of course, you can always go about the standard of care if it's 4s, 5s, and 6. You put them on like a tyrase inhibitor or something like that beforehand. If you want to be extra cautious, but in this treatment plan, this person was just treated with these modes with no other anecdotal treatments beforehand. This is another view of that. I mean, it's a beautiful result. Especially because this right here, there's no laser on this, but this is PIH from acne. So this is actually clearing out the PIH, but not furthering more irritated tissue to lead to more hyperpigmentation. So UltraClear, this is for wrinkles, fine lines, advanced lines. of periorbital aging. So these are my jam, because I love older people with lots of wrinkles. So UltraClear mode combines the therapies. So you have Clear, which is your superficial, Clear Plus, which is your deeper but resurfacing, Ultra, which is your neocollagenesis pathway or scar remodeling, and then you can combine Ultra and Clear together in one single pass. So you can get resurfacing as well as deep tissue remodeling in one single pass. You can break it up if the patient is pain intolerant or is like, ooh, that's a little bit too high. Or you can do it together, depending on if they're in the OR or if you've had topical on them for quite some time. But it speeds it up. Now, I don't know if any of you have used older school Erbiums, but they take forever to use. And this technology is going from basically dial-up to fiber internet. It's a big difference. Can I do some of the things I can do with the older technology? Absolutely, but can I do it as fast and safe? Can I get better, faster results with less downtime? No, I can't. So this is a typical recovery. This is a pretty mildly aggressive treatment in my office. And you can see by day 5, she's almost completely re-epithelialized, and by day 6, she is. Now, if I was to do this with traditional Erbium, with a large coagulated zone of impact, this patient might have looked like day 2 for about a week, and day 4 for about week 2, and then day 5 by about week 3, and then about week 4 is when they look at day 6 here.
Yeah.
And these are some great before and after photos of just a customized treatment before, 3 months post-1 treatment. So you can see really nice improvement, especially like in the perioral eyelids. The crow's feet, looking at the tissue remodeling, the lack of wrinkles, and overall skin improvement. This is a great UltraClear treatment, looking at the overall superficial hyperpigmentation that was taken care of in one single pass. As well as tissue tightening and scar remodeling and overall wrinkle reduction.
And we sometimes, when I have a patient like this for a facelift, I have David treat him 6 or 8 weeks before, because that facelift's not going to fix this.
Yeah.
So it's fantastic. And then they look like that, then you can do a facelift.
So it's a matter of making sure that if you're repairing the body of the car, you also repaint it at the same time. So yeah, me and Dr. Rohrich have a great reciprocal relationship, because he says to patients, I fix their skin, and he fixes the excess skin. So this is another great before and after photo. Looking at how you can customize these treatments. These are in-office procedures. These aren't something that we're taking when we're out here in twilight. We're not putting them under. This is just a typical topical. Now, of course, if the patient is really pain intolerant, you can do local blocks, mess and all that fun stuff. But very rarely, the only time I truly do blocks anymore for laser is if I'm doing completely ablative and I'm like 50 to 60 microns deep around the mouth, like if I was blowing their perioral radius to move it back. This is looking at resurface with UltraClear mode. You can see really nice tissue tightening. I assume this patient might have had a neck lift too, but maybe I'm assuming that's not just laser, but if it is,
it's just
everyone needs that's just laser. Oh, pretty good. No, that's not pretty good. That's damn good. That's really good. Okay, yeah, that's awesome. Good for Dima, Dr. Ali. Yeah. This is looking at perioral rhytids. This is one of the areas that is very hard to treat. Even if you treat it surgically, you do a lower left and upper left. Sometimes this excessive tissue in the lateral orbit is kind of hard to get rid of without getting that kind of wingtip eyeliner scar that most patients don't want. So we can do some tissue remodeling with customized UltraClear. This is looking at, now I love eye shields, so I'll put shields in anybody in office as long as they're not claustrophobic and attack their upper eyelids. And I won't say that I get upper left-like results, but I will say if I can get 25 to 45% improvement on a lot of my patients, they're happy. Yeah. They're happy, and there's no surgery, so they're fine with it.
And the great thing is, with a left, you can do that.
Yeah.
You can do it concurrently, it's fantastic.
This is another customized treatment. You can see this nice vascular lesion that she had that was completely erased from it. So before and 6 weeks post, and then the one before that was before and 2 months post. So you can see just the overall tissue regeneration that you can do by combining these modalities, using the Ultra for your, of course, your tissue remodeling, your neocollagenesis, and using the Clear for your resurfacing and clearing out pigment and dyschromia in the skin. This is actually one of my patients. This is one treatment. This is 3 months post a single session. Now, this is actually the first patient I did on September 10th last year.
My owners.
Yeah, I was scared to death. I was scared to death because I didn't know, I knew what I was doing, I knew how to use an Erbium, but I didn't know know how far I can push the envelope. But since then, she actually is having another treatment this fall because she loved the results. But she's a ginger naturally, so next time I do her, I'm gonna have to give her a little bit more anesthesia. But in general, she had a fantastic result. This is another one of my patients. What I like to treat is if you look at the radial cheek lines, that is a very hard area to treat. It's especially difficult to treat with any sort of filler or biostimulation. Sometimes they're very resistant. So this was just an ultra pass and a clear pass on top of it. Here's another one of my patients. This guy was like extremely thrilled. So was his wife. She's like, he looks amazing. Because if you look at all the dyschromia in his hairline, you look at the diffuse vascular redness throughout his middle third of his face, this is one session. Now, I don't mean to discredit any men in the room, but we typically don't do well with procedures. So, to be able to have a guy come in and get a pretty aggressive laser treatment and say, oh yeah, I want to do another one in about 9 months, I was like, okay, cool, yeah. So the healing and the comfort of having this type of treatment and using the blended pulse technology is even good for your male patients that typically can't handle anything. This is a side profile of that. He's actually thrilled with the results. And you can see even like his upper eyelids that I did some laser coring on his upper eyelids. Did I give him a blepharoplasty? No. But did I improve the aperture of his eye? Absolutely. There's another view of that. Yeah, his wife is thrilled. I think his wife is more thrilled than he was. So laser coring, I'm going to pass it over to Dr. Mark so we can talk to you a little bit more about laser coring.
Yeah, so questions so far? Yes?
So can we do an any speed type, the Fitzpatrick?
Any Fitzpatrick? Yes. Yes, that's the amazing part about this.
You know, I would discuss with the clinical team on what settings to use with higher Fitzpatrick types. You know, like ultra, absolutely, you could do it on higher Fitzpatrick types because the zone of coagulation and the blended pulse technology is going to interfere with the melanocyte activity and cause like hyperpigmentation or hypopigmentation. But if I had like a Fitz 5 or 6, I would probably put them on a tire disintegrator just to be extra cautious. As far as clear, any Fitzpatrick. As far as clear plus going 40 microns or deeper, you just want to be careful with your density on like any patient that's prone to hyperpigmentation. So you can customize treatments for any Fitzpatrick type. There's just going to be some settings on the device that might be riskier in higher Fitzpatricks than others. But even at some of these settings, you can turn off the coagulation. So there's not a lot of heat signature left behind, so your risk of hypopigmentation is still very low.
How about someone that has lupus or, some immune disease?
Yeah, so I'm not scared to treat autoimmune patients, but I do tell them that your healing journey might be more prolonged than anything else. With the fact that this thing has no consumable, I have 2 types of patients. I have one patient that comes in that says, David, blast my face off. I only want to do this once every 18 months. Fine. I blast your face off, you're out for a week. And then I have patients that are like, I can't have downtime, I want to have it done on Friday, and I have to work on Monday. So I will take a series of treatments and combine a series of 3 to 4 treatments to get the same result as one very aggressive treatment. So like on my autoimmune compromised patients, I would probably talk them into doing 3 or 4 medium to light aggressive settings, so I don't have to worry about any sort of autoimmune healing disorder or sequelae of that. But because there's no consumable, it doesn't cost me any money either way, depending on the treatment pathway I choose.
And the recovery is so minimal. I mean, that's what, to me, was the game changer. It truly was. And then we've also done mechanical coring, which is Acclero. It's a great technology. One thing is Dave and I do a lot of trials, clinical and FDA trials. So we've worked with all these companies, and Acclero, this is mechanical. It's the only one that I think is commercially that's great. But when you compare it to the fiber laser coring, because really there's laser coring and there's mechanical coring. And there's really the only 2 companies that do. Laser coring is only done by UltraClear, and so we've talked a lot about that. And the mechanical coring is good. It's just and the 2.0 is much better. Yeah. And it's actually it's obviously a bigger diameter. But we initially had a little more pigmentation issues, and Dave can talk about that. But the laser coring just hasn't had that issue. So, and again, it's been that, and So David, you want to talk about mechanical a little bit?
So basically the difference between mechanical and laser coring. Laser coring here is interesting because it's shooting these tiny little pulses in the skin in this flower-like pattern in a repetitive motion. So it's drilling down using laser energy. Whereas mechanical is just punching a hole through the skin. So with mechanical versus laser, I get similar results in the end. However, mechanical tends to be a little bit slower. It's not as fast of a treatment. It's a little bit more labor intensive because there's no coagulation when you're dealing with mechanical versus laser, so your patient's bleeding a lot, etc.
A little more downtime.
A lot more downtime. It's not a lunchtime facelift like the so a little bit more downtime. And my patients with my mechanical definitely heal. It's much more prolonged healing than with my laser.
Yeah.
But with mechanical, there's no heat, so I might opt to do mechanical on a really high Fitzpatrick and then do laser coring on a lower Fitzpatrick. So I think they both have great opportunities at the table. You just have to understand on each device, which each device has on its own, and where it's going to exceed in certain populations.
Yeah. And this is why I love laser coring and then UltraClear and then the paint or the glide. I mean, that's kind of what I use a lot. It's a little aggressive. And look at Mary Lupo, that neck, I mean, that was a game changer. And I don't think you can do that with anything surgical or any other laser. So these are some examples of that. Laser coring and, with, really deep collagen remodeling. Obviously, and this is a really good result for just laser coring itself, but I use it in the face and the eyes, and I'll do there's a laser coring light, which I don't know if we'll do that today, but basically you can actually correct a lot of the fine wrinkles with that, especially in the crow's feet. And that's what, and Brian Beisman is an excellent oculoplastic surgeon. He does that well in that. Again, it's that deep collagen resurfacing that really has really been phenomenal. And again, you can't get this without laser coring because it also does some tightening deep. And of course, this is a phenomenal result. Again, these are the types of patients I like to set. David do full face and neck, and then I can do their facelift. And I'm going to show you an example of this type of patient. She's a patient I did, and I'll show you. Here's her pre-op. We did a face, eyes, lip lift, and I did laser coring, and I did UltraClear, and then I did, of course, glider paintbrush. So we did all those modalities. That's the last thing I do. And I think I went down the UltraClear. I did 750 microns. She's obviously got a long lip and thick skin. So after that, this just shows her face and neck. And then I'm going to show her at 2 days. Now, I can tell you at 2 days, she looks better than any other modality. This is a 2-day post-op. This is her reveal when we did her facial. Took her dressing off, and you can see, and she had minimal to no discomfort. Now, we also use Ariessence, which is PDGF, and David's going to talk about that. That also is a game changer. You put this on, I put it on intraoperatively, and then we save some and put it on every 6 hours for the first 24 hours. It's amazing. It's the first platelet derived growth factor. And here she's at day 7, just to show you what it looks like. And then this is when we take off, her eyelid sutures, and you can see she's almost healed. I mean, and I went very, very deep here. I think I went over 1 millimeter and then 750 microns for UltraClear. So it's pretty it's impressive. Now this is, obviously a deeper type of technology, but David does these in the office. I'm not as daring as he is, but and here she is at day 7, at 13. I just saw her last week. She looks great. I mean, and the great thing is, the only thing they ever would complain about would be their laser resurfacing. Now, she can complain about something else. But here's just something you want to make.
Yeah, what I was going to say, the most interesting part about that entire video, besides fantastic before and after results, so congrats on that, but is she was